Yeah. So I don't necessarily like you're never going to fully deplete ATP. Like bad things would happen if that were to be the case. But what you're doing is like you're basically fatiguing the motor units that are your like think about like the hierarchy of motor unit recruitment. Like you're going to start low and you're going to get high. But once you start fatiguing the higher motor units, you have to pick up the slack with whatever you have left. So like training to failure is basically forcing the entire spectrum of your motor units to have to work harder than they're used to working. And in conjunction with that, you're also creating a large metabolite buildup in the muscle because it's under, like you have a compressive load the entire time. So basically what you're doing is your muscle is preventing new blood from getting in, or the contraction of the muscle is preventing new blood from actually getting to that muscle. So that's exactly what BFR does, right? That's why BFR is so effective at maintaining and potentially helping build muscle mass, because all it does is it creates an occlusion of the blood vessels to limit blood supply and creates a large metabolite buildup, which then has some favorable endocrine responses with that. But basically, it's getting the muscle to work harder to failure without actual load or without appreciable load like you get with bodybuilding, right? I can't remember where I started with that tangent, but it was interesting. Sorry. Uh, Sally, what were you saying before that? You mentioned
You're talking about bodybuilders going to failure.
yes,
Like rest time in rest time.
Yeah, so rest time. So that's why I was going with that. But now think of the alternative. If our goal is building somebody or trying to make an athlete more powerful, like say their relative muscle mass is a lot better and their maximal force is decent, how do we make them more powerful? Like what sort of interventions do we do to increase someone's rate of force development or to increase their ability to generate impulse or jump higher? Like how do we elicit those types of adaptations?
Well, for like power lifters, you do a low amount of reps, but like at like 80 or 90% of their one rep, and then you take 5 to 8 minute rest. Everyone sees those memes of the power lifters at the gym with their Rice Krispie treats taking really long rest breaks, but that's because then they can put in their most amount of work in those high percent of their 1 RM for low reps.
Absolutely, yeah. So one thing I will say is like that's max strength, right? It's like what you described, like powerlifting in that sense, like above say like 90% is going to be like very max strength oriented. So that's maximal force output. What about from the power side of things? I still agree the rest periods have to be long, but like what sort of exercise selection would fit into like that power category?
I feel like you would have to do low load at a quicker rate.
Yeah, so exactly. Like velocity and intent for power are the biggest thing, right? And it's going to be person dependent. But like you could have somebody hold two 15-pound dumbbells and do a squat jump, and assuming they're doing it quickly, that's going to be more of like like oriented towards the power side of the continuum because you're increasing the relative body weight, but you're having them move as quickly as possible, right? That's assuming they can do already like unloaded squat jumps. If you were to go down the spectrum a little further, say it's a weightlifter or CrossFit athlete, they're doing like clean pulls or power cleans or something like that, where they're moving very quickly with a heavier external load. But that kind of shifts towards the higher load, but lower relative velocity. So the maximal or the peak power of that might not actually be as high because the speed starts to creep down as that happens. All right. What other topics do we want to discuss so I don't just go down training rabbit holes? Any pressing discussion? Kayla, your dog's
There's a dog barking in the hallway in my apartment. Since we were kind of on the topic of power, could you just
oh sorry, go ahead.
Could you touch on the difference between like power and elasticity when it comes to like speed oriented movements?
Yeah, absolutely. So like the way I look at power is I think of like power starting like overcoming inertia or starting from a static position. So like one way you could visualize it is imagine like doing a seated box jump where you start in a seated position and then from the seated position you immediately jump up onto another box, right? So I think of that as like that's a contractile moment where you're using your lower extremity, your quads to push off the ground and jump up, right? So if we're talking about stiffness or elasticity, that's the ability to transfer momentum or energy from one repetition into the other to more efficiently, like I think of it as like doing a pogo into a box jump, right? That's more elastic because you're already starting with momentum, but you're using that momentum to then do something more dynamic. So you can think of it as a power lifter is going to be extremely strong and potentially like very explosive and very powerful. but their ability to utilize elastic energy or like stretch shortening cycle, because they don't do it, is going to be abysmal, right? So if you were to have like a power lifter do like a repeated box jump or a rebound jump, they probably wouldn't efficiently use energy. But if you were to have them do like a single effort box jump, they could probably still get very high, right? So look at power as like overcoming inertia and starting from like a relatively static position, and elasticity as using pre-existing momentum to continue moving forward or to kind of build on top of. It's like I fall into this category. Imagine doing like a vertical jump from like a standing position versus doing an approach jump to a vertical jump. So ideally, for someone who has a good ability to utilize elastic energy, their approach jump will be much higher than their static jump. But if you have somebody who's like very explosive but not very elastic, they might actually be better at their static jump because they have more time to generate force to do that. Does that answer your question? Perfect.
That's kind of where you can go down the rabbit hole of chasing like more of the muscular versus tendinous recruitment, right? Like stretch shortening cycle, getting into like, especially like Achilles is where I think about it the most, is like looking at, are you using like the gastroc complex versus like the Achilles tendon as like a rubber band to accomplish your task?
Yeah, like are you all familiar with like the initiation strategy for plyometrics? Like the idea of like, are you doing like a non-counter movement jump? Are you doing a counter movement jump? Or are you doing like some kind of other initiation into that movement? That's exactly what Jacob just mentioned. It's like you're asking yourself, what are the starting conditions for how I'm generating force or how I'm generating impulse? So if you want to condense it and make it like more safe to fail, start with a static position where they're doing a pause in the bottom, or they're doing a seated box jump. And once they show the precursor ability to do that, then you can start adding elements on top of that in terms of how they get to that same moment. So it's like, all right, they can do the seated box jump, do a counter movement box jump. Okay, they can do that. Do like a heel drop box jump where they start on their toes and they drop down. Okay, they can do that. Do a pogo in place to a box jump. Okay, they can do that. Have them do like a linear pogo to a box jump. It's like there's so many ways you can be creative and kind of build these things together. But look at them as like, start by kind of thinking of like, what is the simplest version of this pattern? And then how can I start to add complexity to that as it's appropriate? I think the issue with like social media, as we all know, is we only see those like super, like almost like convoluted versions of those things, but we don't see the precursors for like, where can I logically start someone to get them ready for that movement? And then in a nutshell, like that's programming, right? Saying this is what they're currently capable of, or this is what they've shown me they can do, but how do I logically change some of the parameters to get them to do that more effectively in either a more intense or a more dynamic fashion?
And if you guys want, there's in this module that we're in right now, there's diagrams of what Mike's talking about. So just kind of peek at those a little bit. There's a couple of progressive pictures of that initiation strategy in there.
What other questions you got? I'm going to consult my questions as well. Yeah, I got one. So from a session structure standpoint, how do you prioritize isolated versus integrated exercises? So isolated would be like, think of like your single joint exercises, versus integrated would be something where we're talking like compound movements. Do they have a place together, or do you have to prioritize one or the other? What are our thoughts?
I think for me, it depends on my patient's presentation. So I guess one example that I like to use that comes off the top of my head is like if I'm dealing with someone that has like lower back pain and they have trouble with hinging or squatting, movement, like compound movements like that, especially in the gym. Sometimes what I'll do with them is I'll pair like a Pallof press or like an isometric like dead bug hold to like teach them how to create stiffness through their trunk and like get them feeling that, and then pair that exercise directly going into like a trap bar deadlift or a squat or a goblet squat of some sort. So it's like almost like a primer in a sense of like, this is what you should be feeling, and then like carry that over to the compound movement. That's like the main one that comes off the top of my head.
Yeah, I love that. I mean, I've gotten in the habit of like, I love this for like tendinopathies too, like quad Achilles tendinopathies, where the problem with like, are we all familiar with like the concept of stress shielding? Show of hands if you're familiar. So okay. So the bare bones version is like we are very, very good at avoiding things that are either painful or otherwise like inhibited. So from like stress shielding from like a tendon standpoint would basically be like you're offloading that structure because of the existence of some kind of pain or some kind of like, I wouldn't say pathology, but like something is not quite right in that tissue. So your body is automatically avoiding loading that tissue, right? So if I have a really irritated quad tendon and I go to jump and land, I'm not going to use a very knee dominant strategy because subconsciously or because of my past experiences, that didn't feel good. So I'm going to automatically find a different way to land or I'm going to offload that tissue. So I say all that because I really like that same pairing that Jacob just talked about, using it for like, I'm going to do like an isolated like knee extension iso. Like maybe I'll do like literally like a seated knee iso hold or some kind of like wall sit just to get like a lot of tension and a lot of awareness and like actual like elongation of that tendon. And I will use that as kind of like almost like a pain inhibitor as well as sensation. And then immediately pair that with more of like an integrated movement, like a box jump or a depth drop, or even like a regular squat to see if the pairing of those two things is more effective than if you're just doing one by itself. Because there are a lot of people that like when you kind of trick them into doing those things, they have a lot of there's a large analgesic effect, and you also have a lot more sensation within that tissue when they're then doing the movement that you're trying to get them to in the first place. I think it also adds context because they understand why you're doing what you're doing and why they can't just go straight to what they want to be doing. Any other thoughts there?
I think for me, I like doing isolation if there's like a true strength deficit and to kind of show you can work that muscle. But I try to hit compounds as soon as possible because I think there's a lot of fear with people who especially don't exercise around compound movements, the squat, the deadlift, and they're so functional. So to show someone with low back pain that they can hinge is a very empowering kind of moment. So trying to get them to do that right off the bat. Sometimes it takes that isolation work, like you guys were talking about, to get there, but trying to integrate that as quickly as possible can be kind of powerful for the patient.
Yeah, for sure. You got to give somebody light at the end of the tunnel, right?